Hello, everyone, and welcome back from break. This is our final panel of the 2024 HIDA Prevention Summit. And to give you a little context about this one, it's special. 2 years ago, Dr. Rahul Gupta, who is the director of the Office of National Drug Control Policy, was visiting with the HIDAs at a HIDA directors meeting, and he asked this question: can we do something for middle schools? Can we start earlier? And can we go ahead and lay down a protective foundation before they get into those opportunities, or rather those challenges of being asked or encountering drugs in some type of way? And he wanted it grounded in the best available evidence, but he also wanted to make sure that it addressed opioids in some way, shape, or form in ways that were appropriate. And so we took on that challenge here at ADAPT, and we decided to lean into the best available evidence related to a communication strategy. Today, in this final panel, you'll hear all about this project, which is now wrapping up and is in its final stages, and we are so delighted to share with you those outcomes. I'm going to turn it over to our very own Patty Fersazidis to moderate this panel. We first will be doing introductions of the panel.
Hello, all. I am so happy to be here today. My name is Therese Hunter. I am the Prevention Program Coordinator at Liberty Mid-Atlantic HIDA, also known as LMA HIDA. LMA HIDA covers 12 counties throughout the tri-state area in Pennsylvania, New Jersey, and Delaware. LMA HIDA promotes substance use prevention through the collaboration of key stakeholders, including local drug-free coalitions, schools, and other local government partners and community organizations, to reduce substance use among youth in the LMA HIDA's assigned regions. Through evidence-based programming, we hope to educate our partners on the implementation of programs in our local school districts. A major step we are taking is a partnership with the U.S. Attorney's Office for the Eastern District of Pennsylvania. Later this month, and with the support of ADAPT, we will jointly hold a roundtable with local government partners focused on the topic of implementing substance use prevention in local schools. In addition, October is Prevention Month. If you are local to the Philadelphia tri-state area, please be sure to follow our social pages on LinkedIn and X, formerly known as Twitter, to stay up to date on upcoming events. I am super excited to introduce our final set of panelists who are going to close out our discussions about school-based prevention by sharing the results of a multi-HIDA social norms media campaign implemented in 10 middle schools across the nation. Our moderator for this panel is Dr. Patty Fersazidis, Assistant Director of ADAPT and Associate Director of the Center for Advancing Prevention Excellence at the University of Baltimore. In these roles, Dr. Fersazidis manages training and technical assistance, product development, quality improvement initiatives, and workforce development with the goal of supporting and advancing evidence-based substance use and mental health strategies in diverse settings. Two of today's panelists come from Yakima County in Washington State. First, we have Ms. Alicia Tobin, Executive Director of Safe Yakima Valley, a nonprofit aimed at preventing youth substance use through education and advocacy via its drug-free coalitions and its youth mentoring programs. Ms. Tobin oversees the daily operations of the organization as it pertains to managing all funding sources and ensuring compliance, quality assurance, program efficiency, and program goal achievement. In her role as Executive Director, Ms. Tobin tripled the organization's grant funding and expanded programming throughout the county. Next is Mr. Nick Mifflin, Assistant Principal at Washington Middle School. As Assistant Principal, Mr. Mifflin fosters student leadership and promotes student growth through the school-wide systems. He is a strong advocate for positive behavioral interventions and support systems, or PBIS. He works to implement PBIS strategies that encourage positive behavior, improve school climate, and reduce disciplinary issues. He focuses on creating systems that use student data and student voice to meet the needs of students, including aligning tiered support, creating a community mentorship program, and promoting school partnerships that push students towards academic success. Our final panelist is Dr. Wesley Perkins. Dr. Perkins is Professor Emeritus of Sociology at Hobart and Williams Smith Colleges and Project Director of the Alcohol Education Project and the Youth Health and Safety Project. Dr. Perkins has published extensive research on the prevention of violence and substance misuse among youth. He developed the theory underlying the social norms approach to preventing risk behaviors and has consulted with hundreds of secondary schools, institutions of higher education, and community health agencies about social norm interventions throughout the United States and internationally. On behalf of Liberty Mid-Atlantic HIDA, I'd like to extend a warm welcome to our panelists. Thank you again for joining us today, and I hope you will all walk away with a new wealth of knowledge about school substance use prevention.
Thank you, Therese and Liberty Mid-Atlantic HIDA team for that warm welcome and introductions. Hi, folks. My name is Patty, and I am just thrilled to be here with you all moderating this final panel for today. As Dr. Laura Papard mentioned a little bit earlier, this panel is going to be a discussion of a multi-HIDA prevention project where 10 schools across the nation implemented social norms media campaigns. The states that were involved in this included Georgia, South Carolina, Washington, and West Virginia, and represented 3 different HIDAs, including Northwest HIDA, Atlantic Carolinas HIDA, and Washington Baltimore HIDA. I think one of the things that's especially unique and exciting to share with you all today about this project is how it represents a school community partner approach. A lot of what we've been talking about today has been how community partners can help build capacity for prevention within schools, and this project truly embodied that. All right. 1 second, I'm not seeing my slide control. Let me just make this a little bit larger. Okay. Before we get going too far, what I am going to do is just tell you a little bit about social norms. Here at ADAPT, we've had a number of workshops and webinars related to social norms, so I'm not going to spend too much time diving into the specifics, but I do want to just kind of level set a little bit about what we're talking about here. Simply put, social norms represent kind of the common attitudes and common behaviors within a social group. In other words, they represent what most people within a group actually think or do. So for example, things like showing up to work on time, shaking hands when greeting someone. We all have our own understanding of what most people in a group think and do, and these are called perceived norms, our perceptions of what we think the social norms actually are. Social norms are really powerful. These perceived norms, our perceptions of what most people think and do, are one of the strongest predictors of behavior. The problem comes when our perceptions may not be fully accurate or correct. When it comes to youth substance use, both youth and adults tend to misperceive what youth actually think and do. They overwhelmingly think that substance use is more common or accepted than it actually is. The problem is when youth think it is the norm amongst their peer group to use substances, this increases the likelihood they will approve of or even engage in substance use. So the goal of the Social Norms Media Campaign really is to correct these misperceptions by bringing attention to the true positive norms of that group. The way this works is in a few different steps. There is at a very basic level, you start with an initial identification of what those norms are, trying to assess the student population and determine what they actually think and do related to substance use. Then that information is put back through multimedia channels. That is considered sort of the intervention. If the intervention dose is adequate, what you would expect to happen after that is that those norms are corrected. So those misperceptions are minimized or decreased, and that has a resulting impact, of course, on behavior. So I'm going to share just a little bit about the nature of the TA that ADAPT provided to the schools over the course of this project. So we started in about March of 2023 and went through August of 2024. And over this course, we had 16 learning community sessions that we delivered with our participating schools. A lot of the early phases really began with just orienting them to the social norms approach and what a media campaign is. A lot of the early resources helped the schools and their community partners to build an implementation team and determine the resources that they would need in order to implement this intervention. This included two critical things, which was identifying champions, both a community partner or liaison to really kind of champion the effort, as well as an on-site administrative champion, somebody who can make decisions from within the school and really kind of make things happen. And here shortly, you'll hear from two of our panelists about how this was critical to the success of the campaign. Schools also were provided resources to help them identify trusted adults and train trusted adults along with other school personnel in the approach so that these individuals could help reinforce the true positive norms of the students. And other resources that were available were things like overviews of what are the effectiveness of the social norms approach for those who are interested in learning more about it, creating an orientation video, both in English and Spanish, and creating training scripts for training school personnel and staff. By the way, I'm mentioning a number of different resources. All of these resources have been made available to you here today. So one of the things that we developed, the third tool that Laura mentioned earlier, is a guide to implementing social norms media campaign in secondary schools. In that guide, we have a number of appendices that include all of these resources that I'm describing here, and those are available. Somebody's going to be plugging the link where you can access those resources, including the guide, in the chat here shortly, so you'll be able to access that. So after getting a lot of the early planning done and preparations, we supported the schools with their social norms data collection. So we generated a sample social norm survey that schools could customize and administer. We provided them sample language for how to notify parents about the survey and the campaign. And then schools were able to integrate that into their existing processes for collecting data and obtaining parental consent. We also supported the schools in analyzing their survey data and providing a summary of the positive norms that could be used to develop messaging. Sample messaging was generated and shared with the schools as well as tested out with youth. And then the schools really spent the entire academic year between 2023 to 2024 implementing a number of, using a number of media channels to get these true positive norm messages out. Things such as posters, staff buttons, water bottle stickers, table tents, floor decals, and so on, morning announcements. And then schools uniquely expanded into their own media channels that made sense for them. We also guided the schools in monitoring the campaign. So looking at implementation fidelity, getting school input on the campaign, helping train on-site facilitators to run focus groups to elicit student feedback so that that information could be used to shape the remainder of the campaign. And then, of course, guiding students to the schools through the process of re-administering an evaluation survey at the end of the academic year. The summer has been busy, spent evaluating the campaign project, and we're going to share with you a little bit about those outcomes here today. So what you can expect in this session, first, we're going to unfold the experience of one coalition school collaborative effort that partnered together to implement this project. And then we'll hear a little bit about the findings. I already mentioned to you the guide, and as we go along and as it's relevant, I will point you out to certain resources related to that guide and that are included in there. Now, before we transition to our discussion with our first set of panelists, I want to give you all a fresh look into a newly created video. Y'all are the first ones seeing it, that really takes a look into the experience of community partners, school staff, and students from two Washington State middle schools who participated in this project. Washington Middle School of Yakima School District and Jemtegaard Middle School of Washougal School District. This video was created in support of SE2, one of our partners in prevention, and we're excited to air it for you now.
I was actually in the hallway when they were putting up the posters and like the stickers on the ground. So I took the time to stop and read it.
Many times there's a misperception on the percentage of youth using certain substances. And so the first thing we need to do is identify the misperceptions. I will ask educators or parents, if I were to ask you in the last 30 days, what percentage of 8th graders, boys and girls, do you believe vaped? Overwhelmingly, they will say 60, 70, or 80%. The correct percentage is 7 to 10%. With positive social norms, we flip the narrative and we talk about the overwhelming majority of Washington middle school students choose not to use substances. Because if you are a youth and you believe your peers are overwhelmingly using those substances, you're more inclined to use them. But if you know that the majority of them are not, you're more inclined to say no.
And my friends, when they saw that percentage being very low, they're like, gosh, that's really low for our school. They were really surprised about that.
The premise of the campaign is we're trying to change behaviors and attitudes towards substance use, which is the backbone of prevention.
Students were definitely involved because we realized that students' voices, you know, their voices are what they want to hear.
This program wasn't done to them. They were a part of it. It was their voice, it was their data, it was their words.
Once we identified the actual norms, we then had media printed, and we had things like our buttons, and we had posters, and we had floor decals, and we had table tents.
We put on the posters, this is your voice, this is your school, this is what you believe.
And we took it a step further. We actually made sure that we had youth input on the design of those products.
We're filling our kids' minds with positive ideas, positive concepts, and empower them to say no.
Our school is known for having more drug use, but since the numbers are really high of people that don't use it, I feel like that's good, towards us and our reputation.
When I heard about the 90% of people disapprove, I was very surprised. Not everyone thinks it's cool, and there's people out there that genuinely think it's a bad thing and want it to stop.
I read it, and I was actually pretty surprised that not a bunch of students did it.
I was very proud to be a part of the campaign for the school.
With ADAPT, they give you a guide with the step-by-step procedures.
It was a very smooth and easy process.
I think having that timeline made it as simple as possible for them to maintain the fidelity of the campaign.
I'm a big believer in calm, measured responses. When you subtly bring it in and you've got a plan of how you're going to roll this out, and it's not overwhelming the kids, not overwhelming the staff, it's very easy to implement. I've definitely seen more student voice. I've definitely seen more student advocacy. I'm starting to see pride back in the school.
We try to build a better community. We've been strategizing some ways to help kids quit.
Students need to know that they're cared about, they're valued, that their opinion matters. I think those are the ways that we start making a difference in the lives of our students.
We're just so very grateful to the participating schools, and especially the students and staff within those videos who really shared their experiences and brought to life their unique perspectives and their involvement in the campaign. Now I am thrilled to be able to turn it over to Alicia and to Nick for a little bit of a discussion about how all of the planning and implementation went for them. So you can hear about their own unique experiences as you start to think about how this might work within your communities. So Alicia, your coalition, Safe Yakima Valley, partnered with Nick and other Washington Middle School staff to implement the Social Norms Media Campaign. Tell us a little bit about how this partnership came to be. How did everything get started for you all, and how did it unfold?
Well, thank you for having Safe Yakima and Washington today on the panel. I greatly appreciate it, Patty, and thank you for the question. We actually had already established an amazing relationship with Washington Middle School. They are a trusted partner. And so that part was already established. And we always talk about Washington and their awesomeness. So we already knew we wanted them to be our school of choice. In terms of the positive social norms, frankly, I had never heard of it. I'd never heard of the concept, and I received an email. It started with an email from ADAPT, like, hey, we have this training. And so I participated in the hour-and-a-half training. And then I had a lot of questions, so I reached out to Wes's business partner with Michael and bombarded him with questions to learn more about the campaign, and then I was hooked. So then I reached out to Nick and was trying to explain to him what the project entailed, understanding that it was a long commitment and that there was quite a bit of bandwidth that was going to be needed.
Thank you, Alicia. So you then pitched this over to Nick. Nick, what was your response when Alicia brought this up to you?
I actually, I pulled my email today because I remember the email from Alicia, and my direct quote was, I was trying to let her down nicely. And I said, I'm not sure I can add another project or commitment at this time. I'm sorry. And Alicia, I think I kind of worked with her through email on like, hey, what exactly is required of me if we're going to do this? Because it seemed like a good opportunity for kids. And we're kind of in the boat at Washington. Like, if it's good for kids, we're going to put in the work. And once we kind of laid out what each of us could do, it did become a true partnership where like some partnerships we have are, we are given a lot of things and then you do them at the school. And that wasn't the case here. We were able to work with Safe Yakima Valley, make a true partnership where like we both carried quite a bit of weight here. And like she said, Safe Yakima was already a partner that we work with on other projects and we liked that relationship. So it just fit in with our all hands on deck approach for this model.
So in y'all's case, it helped that you had an existing relationship and partnership that was established and positive, it sounds like. And Nick, thank you for sharing that your initial reaction was, no, we can't do this. There's no way we can make it fit. But having had that relationship allowed you all opportunities for further discussion to really explore whether it could be a possibility. And knowing that it could be beneficial for the students was incredibly important to you. You all have both highlighted that a social norms media campaign in a school setting is something that does require resources. It requires time to plan and implement the intervention, resources for media creation and dissemination, and really commitment to not only see it through, but to see it through with a high level of fidelity so that you are increasing your likelihood of achieving the intended outcomes that you're hoping for this. Share with us a little bit about how you navigated these very real considerations. What were the challenges and how did you overcome them?
I think for me, the greatest challenge was understanding the school's bandwidth, right? Knowing that they had limited time. And so when Nick and I were having conversation back and forth, my commitment was, I tell you what, I'll sit in on the trainings, which were an hour and a half. They were regular meeting points. And I knew that Nick wasn't going to be able, or any of his staff was going to be able to carve out an hour and a half. So I offered to be the primary champion, and then Nick was kind of the co-champion for the school. And I, in essence, spoon-fed them what I thought was the most important information. And also offered to do staff presentations to gain buy-in. Nick created and identified the kiddos that were going to be part of the Youth Advisory Council. And so we offered then to come in and actually hold the council meetings so he could then continue throughout his day at school. We filtered documents. I read through emails. So if we had a lot of emails, I would kind of scrub the content and then turn around and disseminate. Hey, here's the gist of those emails. Here's what's most important. Here's this timeline document. This is one that you're going to want to print and have handy. Offered to do presentations to the school boards, to parents, and basically said, if questions come your way, I understand that you guys are not prevention experts. Send them to us. We will answer them if there's any hesitation or any questions about the campaign. And really from there, it just kind of took off. We sat together and this was reasonable. I think the other thing that was super important for us is Nick and I are both results oriented. We don't do anything for the sake of wasting time. And so it was extremely important for us that we followed the fidelity of the campaign. And so being realistic about the time commitment, also being honest about it, like, okay, yes, this is a 1-year time commitment. We're going to have a survey in the beginning. We're going to have a survey in the end. And just making sure that we were kind of planting seeds and planning for that ahead of time. So we didn't on them in May of this year and say, hey, we now need to do the post campaign we were already reaching out in December and January saying, do the post survey, we need to kind of pick a date close to that.
Thank you, Alicia. And so really, you talked a lot about how, as a community partner, you all burdened a lot of the planning and implementation and supporting the schools through this process. But Nick, your boots on the ground at the school as well. And so you have a whole school, you have a student body, you have staff, you have parents, caregivers. So what was your experience in that process, and really trying to think about how will we engage all of these relevant folks in this process? And what did you find helpful?
Yeah, I think one, obviously we have to leverage our partnerships with our community, right? We wouldn't have done this if we didn't have a partner, because like Alicia said, I was like, I can't go sit in meetings and trainings right now. We have so many different initiatives. I need some help. So we were able to openly invite Safe Yakima, Alicia, some of her team in as just another extension into the school. The kids knew that they were working with us as part of the project. They were comfortable talking with them. We gave them office spaces. They knew how to call kids out of class when they needed them. So I think that's number one, is just being able to partner with the community and find people to help you support the work. The second thing, just to stay committed to it, was just finding how we could fold it into the systems that we already have in place, right? So for example, we do PBIS with positive stated expectations. This kind of fits right in, like we're looking at positive norms that match those. We have advisory lessons where we already work with kids on social emotional learning and sometimes drug and alcohol abuse, things like that. So could we fold it in there? Alicia talked about coming into assemblies. We were able to fold her into assemblies that we already had planned and let her speak to our student body. The other thing it did was it kind of added some of those tier 1 structures that we didn't have. We talk about substance misuse at the middle school level a lot, and typically we're chasing the issue. We didn't really have a tier 1 instruction that was well designed, and this was something that added there, a tier 1 instruction that allowed for a lot of conversations and real-time statistics and data for kids. So we weren't just chasing issues all year, right? Typically it was, we'd have a student that would use or bring something on campus, and you're trying to work after the fact. So this gave us something ahead of time to really try to combat the issue, which was helpful to us. So it just helped fold it into our systems, I think.
Thank you, Nick. I want to highlight one thing that you mentioned, which is the Social Norms Media Campaign is designed to be a population-based universal strategy, environmental strategy. And I appreciate you bringing up how that complemented a lot of what you already had operating in the school and was consistent. And maybe not intentionally, you're really drawing attention to how you all uniquely integrated that focus of the positive norms amongst the students wherever it made sense. Any opportunities that you had to speak to students, or when the topics were already coming up. So even beyond the more traditional media channels and mechanisms, I am hearing a number of unique opportunities to enhance that message. I'm curious if you all could both speak a little bit to your experiences in engaging the staff through this process. You know, they're critical for championing that message as well. Wearing those buttons that you had, you know, and giving them opportunities for students to come up to them and ask them, why does your button say 90%? What does that mean? Tell me about that, right? So what was your experience with staff? Did you receive any sort of questions or skepticism about the approach? How did you handle that? And what was their response, and how did that change over the course of the campaign, if at all?
So for me, one of the main things was you got to gain buy-in, right? They always want to know the what's in it for them, because we knew it was important as the staff were wearing those buttons that said 9 out of 10 or 90%. They needed to understand the program in order to disseminate the information to students effectively. And so it was critical that the staff had buy-in and they had knowledge of the campaign, even at a basic level. So for me, the challenge was communicating it in layman's term, right? So they understood it. So I did that. frequently met with Nick, did staff presentations, and did regular touch points via email, like, hey, how are we coming along on the timeline? What's working? What's not working? Met with the Youth Advisory Council. And I think a couple of the surprises that came out, one was among staff. We did have some staff who were skeptical about the buttons, not necessarily at Nick's school, but one of our other participating schools. We had a principal who, in his own words, thought the buttons were dumb and they would not work. And he reached out to staff to say, is anyone even asking you about these? And he was knocked off his socks because he said every single one of his teachers responded and said yes. And then he was still skeptical and said, okay, was it like one student who asked? And it was multiple students who asked. And then when we met with the Youth Advisory Council, we would say things like, well, what did you think about this poster or that poster? Or what did it say, or the message? And they're like, yeah, nobody really reads them. They don't pay attention to them. We don't know what the message is. And as we dove deeper and asked more probing questions, one of them indicated they were annoyed with the PA announcements, and we're like, well, why? Well, because they've been saying them for 2 weeks. Well, what does the PA announcement say? And they were able to regurgitate the entire thing verbatim. And so then we were like, well, that's the whole point. You just quoted the message. And then some said, oh no, we don't read the posters at all. I couldn't even tell you what they say. Well, do you believe the information? Yes. Well, why do you believe the information? Well, because there was a student survey done. Well, how do you know there was a student survey done? Well, because there's a disclaimer at the bottom of the poster. And of course, that's the itty-bittiest writing. And so then we knew they were reading the posters, even though they admitted they were not reading the posters. So those were a couple kind of aha moments, like, oh my gosh, this is working. And then staff indicating some of the conversations that were taking place was really fun to hear.
Thanks, Alicia. Nick, did you want to share anything else about the staff engagement from your perspective?
I mean, I think Alicia touched on a lot of things staff-wise. Like, anytime you try a new initiative at a school, since we get so many rolled out, sometimes it's like, all right, here goes another one. And I think it was a surprise at how many kids would come up to you and be like, what does that button mean? And it was just a conversation starter that we didn't have in the past, right? Like, some people don't want to talk about the topic if they don't have enough information to share, or if they don't feel confident. And just having something that said like 9 out of 10, and it's like, hey, that means 9 out of 10 kids here don't use. And that's a powerful conversation to have with trusted adults. And like, early on, we kind of had limited buttons. And so it made me be really intentional about who are the trusted adults that I know are going to have the conversation that kids are going to ask and believe them. So I think that was powerful on the staff side. And by the end, I mean, they came to shoot the video, and I asked for some buttons back, and I still had staff wearing them this year. I had some with lanyards that had 8 or 10 of them on them from the year. I think the other thing is just putting it out into all of our channels of communication helps staff see it and students see it more often, and just kind of helped fold it into daily part of our life, honestly.
You know, that's a really important point to draw out. You know, the Social Norms Media Campaign at its core involves disseminating this positive messaging, but really where the opportunity for a magic and enhancement comes through is whenever that message, those become part of the everyday discourse and conversation amongst the staff and trusted adults with students, and even amongst students, we would hope amongst themselves as well. So thank you for drawing attention to that. You all have both mentioned the role of students in this process. Obviously, they are not just recipients of information, right? They have actively engaged in this process. And Nick, you mentioned that was important for you all, that there be student engagement as appropriate for a Social Norms Media Campaign. So talk to us a little bit about how you all engage students and what you've heard from them that they got out of that.
So one of the first things that we did is we called them youth advisory councils. And each school that participated got to select their own youth advisory council based on their own criteria. And Nick can correct me if I'm wrong. I believe he took a little bit different approach. He had some that were high achievers, but he also wanted some youth that had experienced some referrals for getting caught with substances or maybe some behavioral concerns, because he wanted input from their perspective as well. And so they really they designed everything. We said, well, what colors do you want? Do you want big font? Do you want little font? What are you going to pay attention to? Where should we put it? And they would be very honest, like, yeah, you shouldn't put it there. It'll get vandalized. Oh no, that, they will tear those apart if you put them there. And ironically, they designed the first set, and when we met with them before spring to create our second set, they were like, yeah, we don't really like the first set. And we had to remind them that it was their design, but they had already grown out of that and were ready for something new. And then they talked about what worked and didn't work for them. And some of them came up with unique ideas. Like Safe Yakima had some additional things, so we got some yard signs, and many youth said, oh yeah, when our parents are dropping us off or we walk up, we see the yard signs. Washington has the digital TVs that are around the school, so they were able to put digital images on the TVs. So then obviously those can't get vandalized or taken down. And then Safe Yakima created a bunch of social media posts with different designs, with different messages for all the different attitudes and substances, and push those out and would tag Washington Middle School so they could then get the messaging out that way as well. And that was all feedback from the youth.
So I think that's a really important thing that folks often ask about is, what is the appropriate role of youth in a social norms media campaign? And I know I'm probably echoing Wes here, and he's mentioned this so many times, as well as some of our other social norms experts, is when it comes to a social norms media campaign, we have to keep in mind that youth are in the misperception. They may not initially believe the message when they see it the first time, because they tend to think use is more often amongst their peers than in fact it is. And the data really showcase that. But where they have such an important and critical role is in how they would best receive that information, identifying those communication channels, having a sense of what's going to attract your attention and have you engage with that message, and really helping get their input on some of those design elements to make it relatable to them and engaging with them. Use language that's also relatable to them as well, and represents the culture and the various cultures and groups within the schools. No intervention unfolds, certainly not a year-long intervention, without some challenges or hiccups along the way. Can you speak to any challenges that came up in your process and how you overcame those?
A couple that we experienced was the communication. So as part of the campaign, ADAPT provided templates for letters to send out to parents, so parents knew in case their youth came home and were talking about it, or if they were in the schools and saw the messaging. And again, so the schools could aptly respond. And one of the participating schools, this was not at Washington Middle School, had a 5th grade class. And because 5th grade wasn't really participating in the campaign, they opted not to send the letters to those parents. And of course, they were the parents that came forward and had questions about the campaign. And so I would highly recommend that if the communication is provided, and regardless if the youth in the school are participating in the campaign or not, send out that letter so everybody is aware. It increases awareness, and you can address those questions ahead of time. And I think the other thing was just the sheer skepticism. When you have those that are concerned about parent response, or maybe the school board response, or if it's going to work or not work, are the youth going to even engage in it, is just having that belief and being prepared to overcome those objections.
Thank you, Alicia. And folks, in the guide for implementing a social norms media campaign in secondary schools, there is actually a section dedicated towards how to address skepticism or pushback, whether it be about the effectiveness, whether it be about the messaging itself, thinking, no way, that can't be right. There are different strategies that are included in there for how folks can overcome that challenge. Nick, was there anything else that you wanted to share that you saw from your perspective that came up that needed to be addressed along the way?
Yeah, you said one thing the last time you spoke about the part of the point of a social norms campaign is catching their attention. And let's be honest, at the middle school level, attention and focus is not our strength, right? So like just hanging posters in the hallway wasn't going to be enough. They're not focused on the posters, they're focused on friends while they're walking up the hallway. So I think one thing was just where can we get messages out that are going to catch their attention? And that was a learning curve, right? Like, but we worked with our ASB students on that. Like, where would kids see these? And one thing that came from that was getting it on social media, and not just as a post, but sharing it out to stories, because kids were more likely to click on those really quick and filter through them. Getting them out on our digital TV displays. We actually didn't use the floor stickers. We instead, they're so big, we hung them on bathroom stalls because they would stick right to those. We put messages in the bathroom above the sinks. So I think some of it was just where can we make sure to catch their attention, and that was a learning curve. And the second thing was we're shifting a student mindset, and that's a challenge. You are creating a new norm, and that's different because the norm to start the year was, if you'd ask most kids, they're like, yeah, most kids use. But by the end of the year, that was not the norm, because they had been blasted so many times with different messages in different ways, reminding them that it's their own surveys. So that again was a challenge, but it was a positive challenge.
Thank you, Nick. You know, we're here shortly. We're going to hand it over to Wes to discuss some of the findings from the campaign evaluation. But you all both mentioned your solutions focused people. And Nick, you've mentioned data more than once. I know you really like data. So I'm sort of curious, you know, what do you see as the value of taking the added steps to measure the campaign impact? Right? You could have just implemented this. It's been shown to work, but it was important to you all to be able to assess the impact of the campaign. So I'm curious, what do you see as the value of that from your perspective, Nick, as an administrator? And did you collect or track any additional data beyond the social norms survey data?
Yeah, so I like to know if we're going to spend the time to do something, to know that there's a payoff somewhere, right? That it's going to have a positive change. So one thing, and we'll save letting Wes do the data based off the survey, but one measure that's just a really easy pull for us was just comparing our referral and discipline numbers for substance use on campus. And I wrote the number down. So the year before we started the social norms campaign, we had 58 referrals for students that were caught with a substance on campus. The first year within the campaign, we already reduced that down to 27. So you're cutting that number in half. That caused us less issues on campus, less usage on campus, less students bringing things on campus. The other one that we couldn't measure, but I think is really powerful, is just those amount of informal conversations that happened as a result of the campaign. You can't go measure how many times a positive adult got to say a positive message to a student in relation to substance misuse and the positive ways that those happened. But I think it's really powerful and something that should be noted, that was a definite increase from where we had literally none, because there were no talking points, to probably thousands of those conversations throughout the school year with adults that kids trusted and wanted to hear from. So yeah, I know that we have a lot more data in the survey, but those are things that we saw on our end that were pretty powerful.
Thank you, Nick. And before we transition to hearing more about that data and the campaign evaluation, Alicia, Nick, I want to give you a final opportunity to summarize what you saw as the key takeaways. Thinking about our audience includes folks representing schools. It includes folks representing community coalitions and other prevention organizations who might be seeking opportunities to collaborate. And if they're considering something like this, like a social norms media campaign, and ways that they might be able to do this, what are some of the key takeaways or things that you think are important to impart?
Thanks, Patty. For me, I think the top three are follow the guide and use the communication tools, as we talked about, so that you are ahead of any potential problems with parents and concerns with the campaign. Two, as Wes will indicate, and already a precursor with Nick's results, the results and the data speak for themselves. It is truly important, though, that you follow the fidelity of the campaign and that you understand and are committed to the timeline. This is not a 1-month campaign. You really need to stick to that timeline and make sure that you are following the checkpoints to ensure the best results. And I think in our example, If you are an organization that lacks capacity, if you're a school considering doing these campaigns and you lack capacity, reach out to your local community partners to help leverage that, utilize their staff, because again, the results are so impactful.
Thank you, Alicia. Nick, any final words or key takeaways?
Yeah, I think one, the big one is find a way to partner with other people in your community to support you in schools, right? I'll just remind everyone, my initial email was the nicest way I could say no to Alicia and Safe Yakima. But eventually by making a partnership, we made it work. The second one is on the school level. The more we can fit it into our current system just makes it happen and made it just fully integrate, right? Like this is now kind of part of a system that we have where ASB kids know their role, where we get it through our social media channels and it goes on TV screens, where we fold it into our tiered systems for behavior. And I believe that kind of leads to the last point of mine is data is, I think that if you do the hard work up front, that it pays off later, right? So yeah, we had to put in extra effort. I'd rather put in extra effort in a positive manner than have to put in extra effort disciplining students that are bringing things on campus. So our data shows that it did have a positive impact on us because of us taking on some extra work that supported the students.
We're so very grateful to have partnered with you all and so glad that you all took this on and are actually continuing it in the upcoming academic year. So I want to keep us on track. So we're going to go ahead and transition over to Wes, who is going to share with us a little bit about the campaign impact and walk us through his approach to that and what those findings look like. And then when that concludes, we'll share some final remarks as a panel before we hand it over to our Q&A moderator to get us through the question and answer portion of the session. So Wes, over to you. And Wes, you might still be on mute.
There we go. How do we go? As I was saying to myself, I guess, but now to the rest of the group, it's great to be here today. And first of all, to have so many people involved in this project who are able to articulate so well what this model is all about. I'm often on the road speaking to organizations and schools and introducing it, and it's so great to hear other people who are now invested in it, who can explain the process, the potential results, warnings about potential pitfalls, and all the things that you've been talking about. Also, I've been working on social norms projects for most of my career, and it began mostly with college students, and then I began to move out into more broadly young adults in the populations as well. Then we began to move it more into high schools, but there's been relatively little done out there on middle schools in terms of social norms interventions, and they, particularly with regard to specifically substance use and a broad range of substances, and having a coalition of schools all concentrate on this project is I think a tremendous asset, and I'm just really excited about it, and I'm particularly excited about it because of the results. I'm a data person who says, let's go back to the data. The whole model of social norms starts with, well, what does the data tell us about our students? And we find that they're positive, but they don't know that about themselves, as Patty was saying. And so, but then we got to say, well, what does the data look like at the other end? If we actually implement a campaign, if we do it well, if we have good messages, and most importantly, if we dose, that's the key element of once you've got a good message, you've got to have lots of dosage, as they were talking about. Well, what's the result? And that's what I'm here talking about. I'm going to present you with some of the data today. And it's really some exciting results of this. So let me tell you, first off, we started, there were originally 10 schools in the project. There are 10 schools still in the project, but 8 of the schools actually came through with a pre and post-test survey that we could use to contribute to this, what we're calling an aggregate assessment. So This aggregate assessment is based on the 8 schools who were in the time frame and in the instructions about what we needed to do in order to do an assessment. 8 schools actually were able to do that, and all of them wanted to contribute their results to an aggregate assessment of what was being found. So that's what this is based on. And let me see if I can get the control the slide here. There we go. So I want to give you some sense of this, that even though there's 8 schools, this is not a national study. It's an experimental intervention of pre and post what happens. But we do have 8 middle schools, and importantly, they're very diverse. 6 of them are in the Pacific Northwest, 2 of them are in states in the Southeast. So regionally, there's some significant diversity. Perhaps more importantly, we see that if we look at race and ethnic composition, 4 of the schools, the dominant racial distribution is white. That is, the majority of students were white. In 3 of the schools, the majority population was Hispanic, and in one of the schools, the majority population was Black or African American. And so we're working with schools here that do represent a broad range in terms of racial and ethnic diversity. We also, if we're looking at socioeconomic backgrounds, there's a good deal of diversity too. One of the ways we can kind of measure that is look at the schools, the percentage of students participating in a free lunch program. And in one school, a relatively few, that is less than 30%, were participating in that. In 3 of the schools, it was between 30 and 70%. And in 4 of the schools, it was over 70% participating. So again, we see a broad range in these 8 schools in terms of their socioeconomic profile of students. I say all that because it's important, as we have found and argued in other populations, that this is an approach that works broadly across populations and culturally diverse populations. Last thing here to say is that also the types of school. For one example, the population size in grades 6 to 8, there were 2 schools that had 200 to 350 students, 2 schools that had 400 to 500 students, and 4 schools that had over 700 students. So again, the kind of size of the school gives you a sense of the diversity as well. That was, let's see, get the slide working again here. There we go. So there were 2 primary research questions that I was addressing here in this aggregate evaluation. Well, the first one was the question about what are the differences between the pre-intervention spring 2023 survey results. There were about 2,600 students participating in that from the 8 schools. And in comparison, the post-intervention, 1 year later, using the same survey, same questions, but also adding some additional questions about exposure to the messages of the campaigns, and about 2,200 were involved there. So and what are the differences in time was the first question. And then additionally, we wanted to ask the question, what are the differences among students within the 2024 survey who reported low exposure to the media campaigns, those who reported medium exposure, and those who reported high exposure levels to those social campaigns. I'll say a little bit more about how we measured that a little later in what I present. So those are the 2 questions. Over time, do we see a change? And then secondly, what we'll come back to is, what is it that's producing that change? Can we connect it to the exposure of the media messages from the campaign itself? So first of all, we were measuring 4 different substances: tobacco, nicotine, both smoking and vaping were included in the questions. In the survey, we're also measuring drinking alcoholic beverages, consuming marijuana, smoking, vaping, or eating edible marijuana. And lastly, we were looking at using pills not provided by their doctor, nurse, or parent guardian. Pill sharing is an important concern, and that gets back to the connection with concern about fentanyl, is that much of how the risk, particularly in middle school levels, is not students intentionally trying to take fentanyl, but rather simply sharing pills that they don't exactly know what's in the pills, and a big risk there with regard to being exposed to fentanyl in that sense. So those were the four substances that we were focusing on in the survey. The types of measures we included were perceptions about attitudes of peers, what they thought their peers were attitudes were. Of course, we know there was great misperception about that. We were measuring perceptions of peer use norms, what they thought their peers were using, again, expecting and knowing from lots of work previously that they were going to misperceive the actual norms, which are norms of abstinence. We were looking at the perception of peers' parental guardian rules about use. They know what their parents, by the way, they know what their parents' norms are, and overwhelmingly their parents don't, their parents do not allow the use of tobacco, marijuana, or sharing pills. Over 90%. If we look at alcohol, it's at typically over 85% of parents do not allow that. However, they don't know that about their peers' parents. When we ask, well, my parents have rules, but everybody else's parents, no, they don't have any rules. So if they pay less attention to it, it has less effect. So we were asking about what they thought their peers' parents' rules were. The next set of questions was about the reasons for not using substances, a whole a gamut of reasons that students might express for why they don't use substances. We were asking about the ways they selected, how they could, the ways they selected for avoiding the use of substances. What are the different things that they could do? Not going to places where substances were being used, telling other students that they don't want to use, and other kinds of strategies. We were looking at then ultimately at personal attitudes about use, hoping that the more would come on board with their own personal attitudes against use. And lastly, personal use of substances in the last 30 days. Has there really been a difference in use? Now, use in middle schools overall is very low, but we wanted to see if we could actually move the needle on those measures as well. So you take all those types of measures and put them with all those types of substances. There's a lot of questions here we were looking at. A total of 65 measures were examined for campaign impact, because you're talking about all the things you see there on your screen, and then multiply that times all the substances that we were looking at. Okay, so what are the results? Well, first of all, I got to tell you how we approached it. We use logistic regression analysis, and if statistic is in your thing, that kind of geeky methods and so forth, just plug your ears for a second, and I'll just explain that for all the people who want to know what this is if they're not familiar with logistic regression. But basically, it's a quantitative method to analyze data where you've got, for example, we've got multiple schools where they start from different places in their substance use. They have different kinds of students. There's different levels of populations in grades and so forth. And you want to control for all those factors while you're looking at the core differences that you're concerned about. So what we're talking about is in using logistic regression was for analyzing categorical data to calculate the relative odds, the odds ratios, as we call them, of cases occurring in a category of a dependent variable. For example, misperceiving the norm about a particular substance. Or personally using a particular substance. We want to predict that based on categories of the independent variables. In particular, what we were focusing on was the year of the survey. Does when they were responding, either in 2023 or in 2024, how much difference does that make in their actual misperceptions or in their use and so forth? And then we also wanted to look at that with regard to predicting, using campaign exposure to predict their actual levels of use, their misperceptions, and so forth. So that's what this is doing. And the procedure simultaneously adjusts for the variation in data, as I've said, in terms of school level effects and also grade level effects. So what are we seeing then? First of all, the pre-post comparison, 2023 to 2024. Well, when we began to look at that data, first of all, results were in the predicted direction of improved resilience for all 65 measures. All of them went in the direction that we would expect or predict if the intervention was done well. Statistically significant for 59 items. That is, we tested it with inferential statistics to see, is this likely due to chance or is it likely due to an actual difference? And in 59 of the items, they were found statistically significant. First of all, summarizing many of the results, they were less likely to erroneously perceive permissive attitudes and substance use as the peer norm. They were less likely to misperceive those attitudinal norms of their peers. There was an increased likelihood of having personal reasons and ways to avoid substance use. They had many more reasons at the end of this campaign and many more ways they used for avoiding substance use. And then there was a decrease in the likelihood of permissive personal attitudes and also a decrease in the chances of 30-day personal use of substances. Let me give you just a few examples specifically to highlight. One, there was the erroneous beliefs about peer attitudes. That is, that most peers think using each substance is okay, declined by more than 1/3 for all the substances that we were talking about, all the types of use. It declined by more than 1/3. The odds of a student saying yes, they avoid using a substance because most of their friends avoid using it, doubled in each substance. We were really trying to emphasize what their peers were doing and thinking, and we really saw it in this type of measure. 30% reduction in the likelihood of personal marijuana use in the past 30 days. This was really remarkable, particularly if you're in the prevention field, you know it's very difficult to move the needle very much at all. And we cut the rate of those using marijuana in the past 30 days by 30%. And then 38% reduction in the chance of personally used shared pills in the past 30 days. That was a very significant and eye-popping result. Overwhelmingly, most students are not sharing pills, but they cut the rate of that by 38%. So let's look at what happened with regard to students' relative odds in terms of the high and low exposure. That is, we saw these dramatic differences between time 1 and time 2, between 2023 and 2024. And of course, that's the time period when the intervention was going and in these schools delivering these messages in all these kinds of ways. But it could be thought, well, maybe, just maybe these 8 schools, the change was because of something else going on out there. Well, fair enough. So the next question was, can we connect that change in some sense more directly to the campaign? So we looked at students who responded in the 2024 survey. We gave them images at the very end of the survey. They were given images of the posters that had been shown throughout the year and asked, how often, if ever, have you seen these? Do you recall these? Some students said, I've never seen them at all. Some said, oh, maybe once or twice. Some said, I've seen a few somewhat through the year. And some said, I've seen these many, many times, multiple times all year long. And so that's what that kind of response is our high dose response. We also asked the question, showing them some of the other kinds of things like the buttons and the stickers and table tents and other kinds of things they were exposed to, and asked them how many times, if ever, they had seen those with the same 4 categories of response. So we divided it into 3 categories: those who basically said consistently, I haven't seen much at all, if anything; those who said, I've seen some things throughout the year occasionally; and those students who said, I've seen these messages many, many times, through the various media throughout the year. That's the high exposure group. So here what we were doing was comparing the high versus the low, but we also looked, let me just say, we also looked at those who had the moderate dosage, and on everything we were looking at, they fell in between these two groups, those who had low dosage and those who had high dosage. What did we find? Well, the results were in the predicted direction of greater resilience for 63 of 65 measures. 59 of those items, again, were statistically significant. What were we finding? In general, the students were less likely to misperceive permissive attitudes and substance use as the peer norm if they were in the high dosage group compared to the low dosage group. That's what we're doing here. For the survey data at the end of the intervention, they were greater if they'd had greater exposure, high exposure. There was a greater likelihood of having personal reasons and ways for avoiding substance use. There was also less likelihood of personally holding permissive attitudes, everything we would expect from those who were more highly exposed to the campaign. And ultimately, there was a lower chance of 30-day use of personal substances among those who reported high exposure compared to those who reported little or no exposure. Some highlights or examples of that. In that comparison of high versus low exposure to the campaign, those who had a high exposure regarding each substance were 1/3 to 3/4 more likely to accurately perceive other students' parental guardian norm, not allowing any use. They were getting it right more about what other parents' rules were about not allowing for students, just like their own parents. They were less than half as likely to have personally consumed alcohol or personally have used marijuana in the past 30 days. That's an amazing result. That's stark that we saw before the differences between 2023 and 2024, but then when we further looked at those who are highly exposed to the campaign among the 8 schools, we see less than half as likely to be personally consuming alcohol or using marijuana. They were only 1/3, even more of a drop, they were only 1/3 as likely to have personally used tobacco or nicotine in the past 30 days. And finally, only 1/4 as likely to have personally used pills in the past 30 days. So when we looked at that group who had high exposure, dramatically different profile than the other group that was low exposure. So what we come to here is an assessment overall that was really dramatic in terms of the statistical significance across the schools. Of course, it's aggregating the schools. Some of the schools may have done a little better. Some of the schools may not have done as well. And we're looking at that in more detail with the individual reports to schools. But what we know is overall, there was a dramatic change from 2023 to 2024. And moreover, in 2024, the big differences that we were seeing were associated with those who had been much more highly exposed to the campaign than not. So this was great support and evidence for the social norms model and for assuring us that in the field that this is something that can be done in middle schools as well as high schools, as well as college populations, and have a significant positive result. And in fact, we should be doing that in middle schools because that's where the misperceptions are emerging as they begin to think about peers more. And we're kind of doing it on the back end with social norms interventions at the college and at the high school level. And now we have some very good evidence that this can be an effective strategy. Thank you, Patty.
Thank you so much, Wes. Before we turn it over to questions and answers, because I believe there's a number of questions that have come in and I want to make sure we have enough time to get to them. Just kind of want to summarize some of the key things that I heard today. One is schools can build capacity by engaging community partners in this type of an intervention. We saw great evidence of that here today. We're also hearing that strong champions are critical for leading the implementation and promoting the campaign from within the school, and how critical it is to have a high fidelity to that implementation, ensuring that adequate exposure is there. It is in fact critical to the success of this intervention. Know that if resources are available, you're encouraged to evaluate your outcomes. This is how you get that rich information like Wes was just sharing. And lastly, don't hesitate to reach out to ADAPT if you have any questions about how we might be able to support you in your steps for implementing a social norms media campaign. We've provided a number of resources through our guide, and we're here to provide you additional resources if needed. So Laura, over to you for Q&A.
Thank you, Patty, and thank you, panelists. What an awesome project. And I love how Wes ended with, we should be addressing adolescence in its earlier years in middle school and addressing it before it even begins, before these misperceptions have an opportunity to really take a hold and influence that behavior. One of the biggest questions that came out a couple times in the Q&A box was, this is really neat in middle schools. Can it be used elsewhere in other types of youth settings, possibly even extended into the community? Wes, would you like to address that?
Can you, I must have had my mute on for a second. Can you repeat the question?
Absolutely. The social norms media campaign intervention, is that unique to school settings, or can it be implemented in other youth settings or possibly in the community?
Yeah. So I most assuredly it can be done in other settings. I actually worked in settings with summer camps and after school programs, and in some settings where youth were joining together in coalitions and so forth. There are a variety of circumstances. A key or critical issue is, can you get data in those circumstances? In the summer schools, in the summer camps, we were able to do it. In other kinds of coalitions and so forth, you can actually do it in counties in terms of you can survey youth in various counties and do interventions, media campaigns at a countywide level and so forth. And so there are many other ways to do it. Schools are a primary way because they're so peer intensive, and that's where they spend so much of their time. But the model and the strategy can be done in other circumstances because they still misperceive their peers in those circumstances as well.
Okay, thank you. And we're hearing from many of you in the chat and the Q&A box of your way of implementing a social norms media campaign and how it's been successful for you as well. So thank you for sharing those. Nick, this one's for you, and maybe Wes can chime in to the degree that it's relevant, but a couple of questions have come in related to, you had mentioned the infractions and the reduction in infractions. And the first question was, how do you know it was the campaign that actually influenced that result? And then the second question was, the result itself, do you know if it changed based on whether they were exposed minimally or maximally, based on their level of exposure?
So one, we do so many things in schools. I don't think you can ever make a direct tie to one thing, right? But that is our only system change that we had from between those 2 years. Both previous years, we had the same support staff, same system, same curriculum through advisory, social, emotional learning, all of that stuff was stable. That's the only change we had. So yeah, can I make a 100% direct tie that that's the only thing? No, but it was a pretty powerful thing that was added in that helped us with that number. The second question, were you saying, can we tie the students that stopped based on how much they saw the materials?
Yes.
Yeah, I don't think we have that data quite yet per school. Is that correct?
Well, asking me, we have the data, we haven't fully analyzed and distributed it to the schools on a school by school basis. That's coming soon. There is substantial exposure in each school, but there is variation. Some schools got more exposure than others. And so that's another avenue to examine and report is there a direct correlation between the higher exposed schools with higher exposure compared to the schools with lower exposure? So that's a next step in our evaluation process.
Great. And I'm going to take liberty here. It's 4:45, but I know we only have just, maybe 5 minutes worth of more material as we close this up. So I'm going to ask one final question, and I'm sorry we couldn't get to all of them. I will emphasize that this particular guide was developed by our experts and our in-house team. Specifically, Patty did a lot of work on this in collaboration with the co-authors, but it was developed for middle and high schools, so it does apply across the board. So you can feel confident that if you wanted to use this for high schools as well, that it would give you a really strong direction and guidance in that. The final question is, and maybe this is for you, Wes, but please, if anyone else has any ideas, are these results going to hold over time? How can I make sure that they do if I have implemented a social norms media campaign? Essentially, how do we think through sustainability?
Yeah. Well, they will, particularly if they're strong results, and there's been strong dosage as we've seen, they will hold for some time. But this is not a phenomena that it isn't like all these students are in a jar or in a bubble and they're staying there. Every year, if we take the middle schools, the 8th grade leaves and a group of 6th graders come in. And so there's this constant new group coming in, and they're looking to figure out what the norm is, and they start misperceiving things often, very frequently, as they come into new school environments. Of course, what we hope is that those older students who have been exposed to that will continue the messaging process. But it sure helps if you continue the messaging process about the information and the data. The other important thing is that data gets old, in the sense that it becomes easy for students to say, if they haven't done a survey at their school in 3 years, well, none of us participated in it. We're different. And the perception is that we're doing more than what used to be the case. So you have to keep at it. So that may sound like an arduous process, but the other side of it is, if it's working and it's reducing and it's keeping the students at a lower level, it's worth it. It's worth the time and effort, no question.
Wes, Alicia, Nick, Patty, thank you for sharing your experiences and the outcomes with us today for the Social Norms Media Campaign Intervention. We appreciate all of the time and dedication towards this project. It's going on almost 2 years now, and it really has made a difference. And we appreciate you hanging in there with us.